شاه زاد رازا شابتر 33 كاردياك سيرجري كومبليت جايد شابتر 33 ستنتد بايوبروستيك فالفز شاه زاد رازا high yield facts. The most frequently implanted biologic valve is a stented xenograft. The stented bioprosthetic valve may be an entire porcine valve composite from 2 or 3 individual pegs or made from bovine pericardium. Xenografts differ in the method of preservation of the cusps and differ also in the use of anti-calcification regimen and the composition and the design of the stents and sewing rings. Levanova crown phospholipid reduction treatment (PRT) stented bioprosthesis is an innovative device built on the previous generation of MitraFlow aortic valve model. Trifecta valve is a third generation heart valve that complement the St. Jude medical EPIC and the EPIC supra bioprosthetic aortic valve. Carpentier-Edwards Perimount Magna Ease is the most recent stented aortic bioprosthesis developed by Edwards Life Science with a device designed based on its two predecessors, the Perimount and the Perimount Magna aortic valve. The Medtronic Mosaic Ultra valve is delivered with a Kinch implant system that facilitates aortic valve insertion. The Medtronic Mosaic Ultra valve is delivered with a Cinch implant system that facilitates aortic valve insertion, particularly through a tight sinotubular space, and helps prevent suture looping around the stent posts for mitral valve replacement. Despite advances in stent structure and anti-calcification technology, contemporary stented bioprostheses suffer from the same disadvantages of the early models, including the risk of degenerative bioprosthetic stenosis or regurgitation and the need for suture lines. Introduction. Over the past 50 years, a large variety of prosthetic valves have been developed with the aim of improving hemodynamic function, increasing durability, and reducing complication. Nevertheless, there is no ideal valve, and all prosthetic valves are prone to dysfunction. The valve types now implanted include bileaflet and tilting disc mechanical valves, stented porcine and pericardial xenografts, stentless porcine xenograft, cadaveric homograft, and autograft Ross procedure. In patients with aortic root disease, composite grafts may be required to replace the aortic valve and root, usually necessitating coronary reimplantation. Recently, successful percutaneous aortic and pulmonary valve replacement have been accomplished. Prosthetic valves are broadly grouped as biologic or mechanical valves. The most frequently implanted biologic valve is a stented xenograft. These are composed of fabric-covered polymer or wire stents. The valve may be an entire porcine valve or composite of 2 or 3 pegs, and the cusps of the stented pericardial xenografts are made from pericardium using template and sewn inside or outside of the stent posts. Usually the pericardium is bovine, but pericardium of other species has also been used. Xenografts also differ in the method of preservation of the valve cusps, the use of anti-calcification regimen, and the composition and the design of stents and sewing rings as discussed below. Stented aortic bioprosthetic valves. Stented aortic bioprosthetic valves, aortic bioprosthesis. The crown phospholipid reduction treatment valve PRT. The Rivanova crown phospholipid reduction treatment PRT stented bioprosthesis is an innovative device built on the previous generation of MitroFlow aortic valve model. The Rivanova crown phospholipid reduction valve design consists of a single bovine pericardial layer mounted outside the stent combined with advanced tissue treatment. This phospholipid reduction treatment valve that is intended to bolster durability through mitigation of valve calcification. The crown phospholipid reduction treatment PRT bioprosthetic aortic valve can be implanted in either the supraannular or intraannular position. Since its market introduction سنة 1982, the MitroFlow pericardial bioprosthesis has demonstrated good long-term performance in multi-center studies. However, Sina Gital reported a high incidence of structural valve deterioration with the MitroFlow pericardial bioprosthesis. Although many aspects of this paper are questionable, for example, the too high incidence of patient-to-prosthesis mismatch in the published population, the new crown phospholipid reduction treatment pericardial bioprosthesis portends a better long-term durability. The crown phospholipid reduction treatment bioprosthetic aortic valve was developed as an evolution of the Serene MitroFlow valve, where the pericardial layer is mounted outside the stent. The MitroFlow valve design was already shown to provide superior hemodynamic performance, especially in patients with a small aortic annulus. In addition, the crown phospholipid reduction treatment ring is coated with carbofilm that is thought to prevent thromboembolism. In a previous experience from our group with this device, thromboembolic events occurred in 1.1% of patients, which is a proportion significantly lower than the reported in large series from the STC database. However, our relatively limited sample size did not allow us to draw definite conclusions on this matter, and the larger studies are warranted to confirm the benefits of the carbofilm in significantly reducing the risk of thromboembolic events. Trifecta aortic bioprosthesis. The trifecta valve is a third-generation heart valve that complements the St. Jude Medical EPIC and the EPIC Supra bioprosthetic aortic valve. It is a tri-leaflet stented pericardial valve designed for supraannular placement in the aortic position. The valve is fabricated using polyester-covered titanium stent. The stent, excluding the sewing cuff, is then covered with porcine pericardial tissue. This covering is designed to provide protection from mechanical wear by allowing only tissue-to-tissue contact during valve function. A silicone insert in the polyester sewing cuff is slightly contoured to conform to the shape of the native annulus. The valve leaflets are fabricated from bovine pericardium. The porcine and bovine pericardium are preserved and cross-linked in glutaraldehyde. Glutaraldehyde, formaldehyde, and ethanol are used in the valve sterilization process. Additionally, the trifecta valve is processed with Linux anti-calcification technology. The Linux anti-calcification technology is a patent proprietary anti-calcification treatment that is in animal studies has demonstrated resistance to calcification in 4 ways. The Magna Ease valve. The Carpentier-Edward Paramount Magna Ease valve is the most recent stented aortic bioprosthesis developed by Edwards Life Science with a device designed based on its two predecessors, Perimount and Perimount Magna aortic valves. The advanced Carpentier Edwards Perimount Magna Ease aortic biprosthesis adds enhanced